take people over.
Okay, are you ready? Is it recording? Okay, so to open a sterile catheter kit, you're gonna open away from you first, the corner second, and then towards you last. You always open towards you last so you're not reaching over your entire sterile kit when you're trying to get your stuff prepped. Also, 1 inch around the outside border of your kit is considered not sterile, so you can touch 1 inch borders with your clean hands. You just want to be careful that you're only touching those borders. I like to adjust my kit so that it's in a square instead of a diamond, so that's why I turned it. You don't have to do that. Inside of this kit, be careful when you're grabbing things, but you can pull your sterile gloves out of the kit. You always put sterile gloves on outside of your sterile field because they make their own sterile field. Everything in this package is sterile, so you don't want to put them on in the sterile field. So this is just going to go over here for now. Here is one of my drapes. There's 2 drapes that's going to come in your kit. 1 drape is only for males though, so because I'm doing a male insertion, I will use this one right now. Your shiny side goes down, so it's kind of hard to see, but this is my shiny side. So this is going to go down above my patient. It would be easier if he was actually laying down. And then here is my second drape. This one's a little easier to see, but this is the shiny side, this is the non-shiny side. So, I don't have much room here, but it's okay. I'm gonna make do. This is just gonna elongate my sterile field. So I'm gonna put my shiny side down here. This is gonna make my sterile field a little bit longer. And now I have a nice long place to do all of my prep work. The last thing I need to do before I put my sterile gloves on is drop this catheter kit inside of the sterile field. And when I say drop, I literally mean you are gonna dangle it above your sterile field and drop it inside without touching anything. That way you keep your sterile field sterile because the outside of this package is dirty. So that's garbage too. Now I'm all prepped here, so I can go ahead and put on my sterile gloves. Sterile glove, again, is its own sterile field. I'll do it over here. So I'm gonna open up my sterile glove container or package. My first one I'm picking up by the cuff and putting it on without touching the actual sterile part of the gloves. Now this one's on, I can come and hook the cuff of my other one, put it on my hand. I think I should put this on backwards. Oh no, I didn't. And pulling the cuff, still not touching the inside because that's not clean, and adjusting if I need to. So these are all good, and I don't want to touch anything with my gloves except for what's sterile right now. So now, same sterile principles apply. In the home, it's kind of hard to keep all your sterile principles intact, but for the most part, keep your gloves above your waist at least. Don't turn your back on your sterile field. All those good principles still apply. Now I can touch everything inside of here, so I'm just gonna dump this out. I like to put my kit right in front of my patient so that it's ready to go. I have my little cleaning isopropyl, or not my isopropyl, my cleaning iodine swabs. I couldn't think of the word. So you'll have 3 of those. These are already open, but in reality they won't be open, so you want to make sure to open them first. It's very hard to open them with one hand, and as soon as I touch my patient, I only have one hand to use, so I always open these and get these ready. You also have lube. However you want to do the lube is fine. Some people put it directly on the catheter. I always put mine inside of the catheter kit, so I just squirt lube in there and use it and put the catheter in there. So now I'll take my catheter, rub it around in the lube, and I leave that there. And then this would be filled with fluid. This has already been used, so it's not filled, but this would have 10 mLs of fluid in it. So I can get this ready and put it inside of my catheter so it's prepped and ready to go. You don't check balloons on Foley catheters anymore. They used to do that and they changed it. So now this is all ready. And again, as soon as I'm ready to clean my patient, I am one-handed. So I want to make sure everything's done, grab my patient, and now I'm going to go ahead and clean him with these alcohol or these iodine swabs.
Oh,
so it's all right. So we're going to take one swab. We're going to clean from the meatus around in a full circle 1 time. This one's done. I should have pulled them all the way out. Again, we're gonna go from the meatus all the way out in a circle. This one's done. And then for the last one, what I always tell people is with these swabs, you're gonna turn the skin yellow. If anything is not yellow right now, you wanna make it yellow with this last swab. So I'm gonna really make sure to push all of that iodine on my patient so that they're nice and clean. All of this is clean still, but my hand is considered dirty, so I'm still using one hand. With my catheter, which is also clean, I'm gonna start inserting the catheter. You can tell your patient if they're able that they can take a deep breath, relax to make this a little bit easier. You do wanna let them know when you're inserting. It is gonna be a little uncomfortable, but when you start inserting, you just need to go. So you're gonna keep pushing, push. This doesn't have lube, so it's kind of hard, until you either see urine flow, which is what you're aiming for, or if you don't see urine flow or you hit resistance, it's one or the other. If you see urine, you're gonna push up about 1 inch more to make sure you're fully inside of the bladder. If you don't see urine but you hit resistance, you're gonna wanna pull back like 1/2 inch, because that typically means you hit the wall of the bladder. And if you hit resistance and you don't see urine, it's because you're kinking the end of the catheter tube off. So now we'll say I see my urine. I can use my dirty hands and my fingers without touching the tip of the penis to hold this catheter in place. And then unfortunately my tube fell out, but that's okay. And now I can go ahead and inflate the catheter balloon. My last thing I'm gonna wanna do is give a little tug to make sure that this is gonna stay in place, which it is. This is gonna have urine coming out of it, which is why I have it inside of this kit. So until I connect my leg bag, I'm gonna leave it in this kit. But now I can go ahead and connect my leg bag so that my urine is flowing into the urine bag instead. And then of course my last thing is this leg bag needs to go below the bladder, so by gravity all the urine is falling into the bag, and you don't have your patient retaining urine because there's nowhere for the urine to go.